Diabetes and hyperlipidemia are both major risk factors for cardiovascular disease and are closely related to each other. Diabetic patients have about twice the risk of developing hyperlipidemia compared to the general population, and patients with hyperlipidemia have about 1.5 times higher risk of developing diabetes. If diabetes and hyperlipidemia coexist, the risk of cardiovascular disease increases significantly. Cardiovascular disease includes heart attack, stroke, and peripheral artery disease. And diabetes and hyperlipidemia are major risk factors for these cardiovascular diseases. The relationship between diabetes and hyperlipidemia can be explained by the following factors. Common risk factors. Diabetes and hyperlipidemia have common risk factors such as obesity, lack of exercise, smoking, and irregular eating. These risk factors increase both blood sugar and blood lipid levels, increasing the risk of diabetes and hyperlipidemia. Insulin resistance. Diabetes is caused by insulin resistance. Insulin resistance increases blood lipid levels, increasing the risk of hyperlipidemia. Blood vessel damage. Diabetes causes neuropathy and angiopathy, which damage blood vessels. This vascular damage increases blood lipid levels, increasing the risk of hyperlipidemia. Patients with diabetes and hyperlipidemia require the following management: proper control of blood sugar and blood lipid levels. It is most important to properly control blood sugar and blood lipid levels in diabetes and hyperlipidemia. Controlling your blood sugar and blood lipid levels can significantly reduce your risk of cardiovascular disease. Maintain a healthy lifestyle. Unhealthy lifestyle habits such as obesity, lack of exercise, smoking, and irregular eating can worsen diabetes and hyperlipidemia. Therefore, it is important to maintain a healthy lifestyle. Diabetes and hyperlipidemia are closely related diseases, and when they coexist, the risk of cardiovascular disease significantly increases. Therefore, it is important for patients with diabetes and hyperlipidemia to properly control blood sugar and blood lipid levels and maintain a healthy lifestyle. Specifically, it is helpful to maintain the following lifestyle habits: eat a balanced diet, eat a variety of vegetables, fruits, whole grains, and lean protein. Exercise regularly, get at least 150 minutes of moderate intensity aerobic exercise per week. Stop smoking. Smoking damages blood vessels and increases blood lipid levels. Maintain an appropriate weight. Obesity increases the risk of diabetes, hyperlipidemia, and cardiovascular disease. Maintaining this lifestyle helps prevent and manage diabetes, hyperlipidemia, and cardiovascular disease.